Welcome to the CHCI Leadership Conference Breakout Session, Developing Bonds in Adversity for Latino Children and Families. We are grateful to our sponsor, Casey Family Programs. Our panel chair for today's session is Representative Veronica Escobar, who represents Texas's 16th District. She made history as the first woman elected to this seat and the first of two Latinas from Texas to serve in Congress. She serves on the House Judiciary Committee, House Armed Services Committee, House Ethics Committee, and the House Select Committee on the Climate Crisis. Our moderator for this session is Krish Omara Vignaraja, the President and CEO of Lutheran Immigration and Refugee Service. She previously served in the Obama White House as Policy Director for First Lady Michelle Obama and at the State Department as Senior Advisor under Secretary of State Hillary Clinton and Secretary of State John Kerry. Please welcome opening remarks from Representative Veronica Escobar.
Hi, I'm Congresswoman Veronica Escobar, and I'm proud to represent Texas' 16th Congressional District in the safe and secure border community of El Paso. It's a privilege to join CHCI for the 2021 Leadership Conference Presente, Latinos Leading the Way. This great event gives us the space to recognize the outstanding achievements of our community, celebrate our resilience in the face of the coronavirus pandemic, and discuss the most critical issues the Latino community faces today. Among those issues is how family separation in Latino families has impacted our children's safety, well-being, and development. Long-standing economic inequities put Latino families at risk of being separated from their children or monitored by overwhelmed child protection systems that continue to fail future generations. Additionally, a summer 2021 report by the Department of Homeland Security estimated that over 2,100 children separated at the border by the inhumane zero-tolerance policy, a policy implemented by the Trump administration and piloted in my community, still have not been reunified with their families. This is heartbreaking and demonstrates that our nation has a lot of work to do to live up to our promise to protect all children and ensure they can grow up in a safe and inclusive environment. That's why this conversation is so relevant. Today, you'll hear from experts about the structural challenges within child and family systems and protective policies, interventions, and policies needed to prevent family separation, promote reunification, and strengthen Latino children and families within their communities. Thank you so much for attending today. I hope you enjoy and engage in this critical conversation.
Good afternoon. My name is Krish Omara Vignaraja, and I'm the President and CEO of Lutheran Immigration and Refugee Service, or LIRS. Thanks so much to Congresswoman Veronica Escobar for those opening remarks and setting a great tone for our conversation today. And thank you to CHCI for convening this conference and calling attention to this critical issue. I'm truly honored to moderate this discussion. During the family separation crisis, as Congresswoman Escobar referred to, LIRS was one of two organizations asked by the government to reunite families. Caring for and supporting unaccompanied children is a central tenet of our work as an organization, and as a mother, has always held a special place in my heart. Research shows that children are more likely to thrive when they live with family or in family-based settings. We've seen firsthand the power of safe, family-centric, trauma-informed care and how critical the family environment and community connection are to vulnerable children. We know, too, that this work is incredibly important, not just for immigrant children at the border and beyond, but for all children, particularly those in underserved communities, and that's why we're here today. According to recent data, approximately 1 in 5 children in the United States today are Hispanic or Latino. There are approximately 86,800 Hispanic or Latino children in the foster care system, and at different times during the summer, approximately 20,332 unaccompanied children were in Office of Refugee Resettlement or ORR care, and more than 14,500 children were in Health and Human Services facilities. From October 2020 to about July 1st, 2021, over 75,100 unaccompanied children were at the southern border who were released to sponsors. Children in Hispanic and Latino communities are in critical need of support. We need to work together on the federal, state, and local levels to ensure they are given the opportunity to thrive in their communities and beyond. I hope that today's conversation is a critical step forward in that work. With that, let's get started. And as a reminder, please feel free to tweet your comments about the session at hashtag CHCIHHM21. So now I'm thrilled to introduce our three expert panelists. First, please welcome Olivia Sellis, the Los Angeles Field Office Senior Director for Casey Family Programs. Olivia has more than 2 decades of experience supporting children and families in underserved communities and has served as an associate professor in the social work program at the University of Southern California. Olivia, welcome.
Thank you. I'm so happy to be here. Buenas tardes, everyone, and it's a privilege to be here.
So next, I'd like to welcome Megan Fino Velazquez. Megan is an associate professor and director of the Center on Immigration and Child Welfare in the School of Social Work at New Mexico State University. She has spent the past 15 years working at the intersection of child welfare and immigration issues as a child welfare practitioner, administrator, and researcher. Welcome, Megan.
Thank you so much, Krish. Very nice to be with you all today.
And then last but certainly not least, I'm pleased to introduce Cynthia Figueroa. She is the Deputy Mayor of the City of Philadelphia Office of Children and Families, where she oversees the Philadelphia Department of Human Services, Philadelphia Parks and Recreation, and the Free Library of Philadelphia. The office also administers the city's adult education services, early childhood education, prevention programs as out-of-school time and work ready, and coordinates the city's food access efforts. Welcome, Cynthia.
Thanks for having me. It's so great to be here.
Okay, so welcome everyone. Thanks again for joining us. And as a reminder to our audience, you can type your questions for our panelists into the chat box. I know we've got a lot of ground to cover, so let's dive right in. So I'd like to start by posing the first question to all of our panelists. What are the challenges unique to Latino families in regard to child welfare, and how are systems addressing these needs? How can we best support families to improve outcomes for all children and prevent entry into the child welfare system?
So I'll go first. So some of the issues that affect Latino families specifically are the challenges of being in mixed document status families. So you have some that are undocumented and some family members that are not. As we know, Latino families live in poverty at higher levels. And so one of the reasons why children enter the child welfare system is due to general neglect. About 85% of cases enter the system for that. And usually that's a result of poverty. So one of the things that we can really do is provide those basic needs services to families, and on the front end, do more prevention so that children and families are getting what they need and aren't caught up in the system when it's really just about socioeconomic policies and issues.
Megan, do you want to go
I'll
next?
jump in.
I'm sure. Oh, okay.
Jump in. Sorry, from a systems perspective, we know that all children, and particularly, of course, the cultural dynamics of Latino families, that kids strive with their families. And one of the things that we've done in Philadelphia is really elevate kinship care. So ensuring that if there is abuse and neglect issue, which is different than some of the issues children have been separated at the border, is to making sure that we're working with the family as a whole, really around reunification and working in parent groups so that there's an opportunity to make sure the family connection is critical. And the only thing I think does not mention is the secondary language and English language learners. I can't repeat the issue that language access, if you can't ensure services can be rendered in both languages, is a tremendous impediment to families progressing towards reunification.
I think most of what I have to say is really intertwined with the themes that I've heard from our other two panelists. We think that, part of the challenges are related to access, and to prevent entry into the child welfare system. Children need to have equitable access to relevant, quality services early on, and we know a lot about early childhood, and the importance of early childhood services these days. We've actually been conducting a study in southern New Mexico over the past year and a half, looking at barriers and facilitators to service receipt among mostly Latinx, Hispanic families with immigration issues. And we're trying to better understand where immigrant or mixed status families go to get their services for their children and what barriers they encounter along the way. And what we found is that immigrant families often experience barriers to accessing key services, such as our fellow panelists mentioned. Basics like housing, income assistance, food, legal services, mental health services, all tied to issues of poverty. And these barriers are also related to language access issues, a lack of bilingual providers, as well as a lack of materials and services in their native languages. We've also been hearing about cost prohibitions. So even sliding scale services that are supportive of families, many still carry fees, which can be prohibitive for families who are already living in poverty. The legal status and the immigration legal status issue also serves as a barrier, as these eligibility issues cause confusion and fear among families about whether they can use services. And then there can be all sorts of misinformation and misunderstanding about what services people are actually eligible for. So we've heard a lot about the need for greater outreach and education, employing approaches like cultural brokers or promotoras that are targeted specifically at immigrant and mixed status families to help them navigate services and systems. And there also needs to be equitable access to existing services and supports, like in the context of ARPA, or the stimulus bill, like what kinds of equity initiatives are specifically targeting Latinx, Latino, Latinx, Hispanic, I'm using all of these words interchangeably, sorry, so what equity initiatives are really specifically culturally relevant and linguistically relevant for these families? And then I also would say that immigration reform is key to this discussion. So many barriers to access for Latinx families are related to the lack of eligibility due to immigration status or having to wait the 5-year bar for legal permanent residency to access a lot of public benefits. So I think what, we've been thinking a lot about, in addition, the fear and mistrust around policies like public charge, and the lingering impacts of the changes to the public charge rule last year have led many families to not accessing services, even families who are eligible. So to address this, I think we would say that changing punitive immigration policies and more broadly integrating protective policies, such as sensitive locations policies and sanctuary policies at the local level, as long as federal changes are not happening. Those kinds of local initiatives could also help to combat fear. So yeah, I think that was a lot, but I think I'm.
Krish, if I could just add, Megan did such a fantastic job. It made me think that as somebody who represents local government, how we work with the Latino community and how you think about, even with the barriers and understanding that policy change on a federal level can take a considerable amount of time and energy, that there are local remedies. So for example, we did a city ID, and made that available across the board. And we instituted that a number of services, public services, could be available, and this photo ID would serve the purpose so that you didn't use driver's license or social security number. The other thing is, not every city mayor is going to take this stand, but the fact that we made ourselves a welcoming city, a sanctuary city. We fought lawsuits against us that we're going to lose federal funding. So local leadership matters. And I think that sometimes gets lost when we talk about federal positions. So I would just say that in terms of working with the community, having the champions at the local level that can push day-to-day impacts so that access and equal access to services is available. And so, there's strategies I think that have been quite successful in Philadelphia in terms of, not having schools have any collection of any status documentation. None of our public services do that as well. So it's a non-issue, and then it's a message to the community. So that's just, again, not every city is Philly. Very proud of our mayor and the position that we've taken on being a welcoming city. But I would just say local is really important.
I would
That's
have
great.
to agree with you. I mean, Los Angeles has been really progressive in, especially with COVID, really assisting families that without documents and helping with rental assistance and food. And we know there are essential frontline workers and are highly impacted. Sorry.
No, never say sorry. Both of you, kind of everyone, wonderful insights. Please don't hesitate to jump in because that's the nuance that we want in this conversation. So Cynthia, I want to direct this next question to you. So what can our domestic child welfare system teach us about how to best support unaccompanied children entering our communities from the U.S. border?
So I think it's really important to distinguish separation that's happening at a border versus the child welfare engagement. And we have been pretty staunch about this, almost to the point of seeing like we're being obstinate in this, but children should not be removed and in the hands of child welfare unless there's abuse or neglect issue. And solely because a child is at the border and unaccompanied does not fall into a child abuse definition. And so I think it's really important. I think that there's been a push, and certainly we've taken a stand around this too, is that, oh, these folks are used to working with kids, you're used to working on reunification issues, that it makes sense for the child welfare system to begin to be the immediate response tool. So our work or our position has been is to work alongside with our immigration partners and really make sure that legal services and reunification as it relates to there's an intact family or there's relatives. It's a very different method of reunification than when you're working to rebuild a family structure that might have struggled because of abuse, trauma, and neglect that was happening towards the child. So I think it's an important distinction. And I also believe that the other piece is that, the detention facilities itself are, obviously needed. We can't have just kids out in the open air. We know kids always do best in family-based settings. And, the most important thing is to make sure that the resources to identify family and next of kin and establishing those contacts immediately is probably the number one thing that can be done. Independently, I can talk about what we've done around the child welfare side to accelerate reunification or prevention in terms of the overlay between the border and child welfare as a system as a whole. That I think a really important position that I just want to make sure that folks understand.
Okay, so for this next question, I want to ask both Megan and Olivia. So we have children at the border who are consistently flowing into our communities. How do their needs differ from those of children who are already in our communities?
I think exactly what Cynthia said. There's this difference. The children in child welfare come into the system and families are separated due to domestic violence, drugs, issues of abuse and neglect towards families. I think the kids at the border, Casey has been leading an effort at the federal government through a series of convenings and then sending some of their teams to the border to actually work with the kids to try and make the process of reunification much more family and child centered. And so, although Casey's usual line of business is really in the child welfare space throughout the nation, we took on this issue and we were at Fort Bliss and Becos over the summer to help the federal government look at these children and not as detainees, to really encourage the staff and the contractors to take some of the tools that may be relevant in family finding through child welfare and using those to reunify children, because there was kids languishing for days and days. And I think one of the big issues that we encountered while we were there was that, especially for the Guatemalan children, the Mayan children who don't speak Spanish, they were really being left behind. So really helping the federal government develop some processes. So we developed a playbook, and so the needs are really different. It's really helping the child who's coming up unaccompanied to find their place back in their families once they are reunited with families and sponsors, and ensuring that resettlement and supportive services are provided so that the children don't end up in child welfare or juvenile justice, because there is this honeymoon period, and then the real dynamics of the family start to demonstrate themselves. Megan?
Yeah, thanks. I think it's important in this conversation to just point out again, if it hasn't been made totally clear, that one of the differences about what's happening to children at the border and the domestic child welfare system is yes, that children, the abuse and neglect issue, but also that children at the border are systematically being separated from any relative that is not their legal guardian or parent from the very beginning. And the domestic child welfare system would not do that to a child, even if they were abused and neglected. The primary goal is for a child to stay with relatives and families and kin, someone they know well. And so the fact that we are separating them from grandparents, aunts, uncles, cousins, best family neighbor friends, is really problematic. The needs of the children at the border may also, I could see situations where the needs of the children at the border may actually be more acute, given their recent immigration and the traumas that they encountered during the process and upon arrival, and through being separated from family members by the government. So, a key for them may be to get them connected or reconnected family, wherever their families may be, and such as, the work that I know Olivia and her team have been assisting with. I mean, getting kids connected to family as quickly as possible is really key. But in addition, the backlog of our immigration system is preventing children and families from moving forward in their immigration and their asylum cases, and which in turn then further delays their ability to settle down and to find stability and to integrate into their communities, which then places families at risk for later child welfare involvement or even juvenile justice involvement, by keeping them excluded from receiving benefits and keeping them kind of at the margins of our communities. And if they don't have this access to this stable routines that is so necessary for healthy child development, this can prevent all of their physical and socio-emotional and educational needs from being met, as they are kind of lingering in this backlogged immigration system. So again, I think this brings me back to just, pushing again that we need to revamp our immigration system to enable a more streamlined and efficient handling of immigration cases. It's also essential to ensure that all community organizations have the right staffing and the right ability to engage with Latinx families and families who have received children who have been unaccompanied at the border or are recently settled here. Families of recent backgrounds, that the community organizations have the right capacity, the right languages, as this is such as Olivia mentioned, some of the problems they're seeing with Guatemalan and other children who speak indigenous languages. We think that an essential piece of that is to support the educational pipeline of multicultural, bilingual, bicultural Latinx professionals who have lived experience and should really be able to be at the forefront of any response to these children.
Great. Okay, so my next question is for all of our panelists. So Latino families have been disproportionately affected by COVID, and the pandemic has required innovation in service delivery. So can you share examples of what you have done to innovate to improve outcomes? Maybe Cynthia, we can start with you.
Sure. There are a number of different approaches. One is clearly the ability around testing itself, but also vaccination. The healthcare side of things, ensuring that we worked with our community-based partners who had the ability to meet multiple different communities who had various different languages, and so that was critical to us that we could infuse that direct support. We also had worked with FEMA once vaccine was available, and it was important to us that there wasn't just one centralized English-dominated site. We actually located one of the facilities, the FEMA facilities, in the heart of what is our Latino community, and made sure that when we worked with FEMA and who they deployed, were able to ensure that they were bilingual. The other really exciting but not easy lift was when we knew we were going virtual, the city stepped up and actually used our libraries and our recreational facilities to become virtual learning hubs. And the city also promoted Internet Essentials through Comcast and actually paid for internet coverage that's now going to carry through until 2023. So a program that we established called PHL Connected. We produced all the language, all the brochures, the enrollment, all of that in English, Spanish, Vietnamese, and the 5 most spoken languages in Philadelphia, and ensured that we targeted very specific outreach to the Latino community and sent home visiting folks who were working on truancy and after school programs that were trusted and known to the family to help them set up their internet connection, and also ensure that kids got access to their Chromebooks, that they knew how to log on, and then we worked as a liaison with the school district, particularly around English language learners. So there's a lot of very precision type focus on programming that we did to ensure that we were penetrating from the health perspective on COVID testing and vaccination. And we actually, Philadelphia just celebrated, we have one of the highest increase in vaccination of our Latino community. And then the other piece of the ability to provide the virtual centers, that was a little bit of prevention on the child welfare front. We were particularly concerned about kids being home by themselves or left by themselves, or adolescents and younger kids who would be put in the position of having to watch their siblings in order to care for a younger sibling. So those centers proved to be incredibly beneficial to families, and we had a large participation of families in the Latino community. And then the last piece I will say is we, as was mentioned in my introduction, we navigated all the food distribution for children and families throughout the city and partnered with a number of our food distribution partners and the school district. So we actually, the USDA fortunately gave waivers so that we could distribute food to kids even though schools weren't operated, and that was really incredibly important in all communities. And then in different ethnic communities, Latino communities, but also other communities, we were able to also do some culturally appropriate food options for folks that would really cater to families. So there were a lot of, I would say, all the basic need areas through COVID were something that we really, I stepped up pretty dramatically. And what's great is they have now stayed as infrastructure that the city is delivering on an ongoing basis.
It's amazing. It's really incredible, all of the creativity and nimbleness. So Olivia and then Megan, do you want to jump in?
Sure. So, Casey Family Programs at the macro level is part of a collaborative of other philanthropic organizations here in Los Angeles. So, one of the things that the collaborative did was establish what we called our grassroots grants. So, it was providing micro targeting communities for grants. So, really working with the super grassroots agencies that are in community and that historically have not been able to penetrate the contracting system. So we were giving away $5,000 grants to any community organization that was willing to educate, prevention, outreach, engagement, system navigation, and offer vaccines. So that was a way of engaging with the trusted messengers in the community. So that was at the macro level. At the micro level, Casey Family operates a program here where secondary case managers for families involved in the child welfare system. And we were able to give 3 different payments to the families to really just support them in whatever their basic needs might be. We gave, computers to the children. We paid for their utilities and things like that. So early on in the crisis, there was a lot of need for that immediate, like getting the money out in community. And so we were able to do that at both the macro and the micro levels. Megan?
That's really interesting to hear. We actually just completed another research study with child welfare practitioners in about 10 different states, targeting specifically those practitioners who work directly with families with immigration issues. Most of them are Latinx. And some of the things that we heard about what innovations and adaptations have happened in the child welfare world during this time have included using technologies like FaceTime and other, video calling apps to facilitate family visits and court appearances. As you know, I think during COVID, anything in person shut down. And so child welfare systems had, large challenges to overcome in making sure that families, kept their visits and their connections with their children. And a lot of times, especially in New Mexico, I can speak to the problems with the rural nature of some of the communities and geography. It was really hard. Many families did not have access to laptops or computers or even broadband service or Wi-Fi. So we heard several different innovations about how different agencies made laptops and computers available to parents and children, so they would either give them to them, or they would provide appointment times when families could come into child welfare offices or other public places to connect with their children. And then there were several different other formats for virtual engagements during COVID, which really, I think, opened up the child welfare system world to thinking about some long-term ways that are really actually useful and beneficial to helping family members stay connected to their children, even if they're not residing in their communities, if their parents happen to be detained or incarcerated or living in another state or even in another country. So I think there's some lessons that the child welfare systems have learned throughout this pandemic about how to maintain connections with families.
Okay, great. So the next question also for all of you, and I'll add a little bit of color from audience question that is related. So if we want to sustain this critical work in supporting child welfare, who else needs to be engaged? How can they support? And then a question from the audience that is related. How can we ensure Latinos have a seat at the table when it comes to policy making and philanthropic support of Latinos, Latino children and families? So Olivia, do you want to start?
Sure. So I think some ways that some partners that need to be involved are really the educational system, the health system. I think COVID has really uncovered how interrelated all services really are. In LA, what we're starting to imagine is the promotora model and really making that a wellness worker model where we would keep people in community so that they could provide system navigation to families, just orienting them. So both, for families involved in child welfare, if they could get supportive services early on to meet some of their general needs, that would really influence the number of families that need to be separated. Again, with immigrant children, as they enter their families, they need assistance in navigating. How do they get into the high school? How do they get their immunizations? How do they become? A lot of the kids, when I was at the border, were saying, 13-year-olds were saying, I just want to go there and work and help my family. That's what they are here to do. And if we can really maximize on their resiliency and hope by providing some post placement services in their communities, I think that would go a long way in really establishing and creating the supports within a family so that the unaccompanied minors could come and really maximize what they have to bring to this country in terms of skills, work, development. And so I think those are some areas where Casey's really looking at how do we provide some post-placement services in community. So in LA, we'll be working with LA has an Office of Immigrant Affairs at the Board of Supervisors. And so they created that office, and we'll be working with them to see how Casey can collaborate and support some of these families. So as Cynthia said earlier, at a local level, I mean, these children are coming into our communities. And recently I saw a map of like where the Afghan refugees were going, and that's being tracked really closely. And so if we could envision a map like that for these unaccompanied youth, there might be more that at the local level we can do to really support the integration.
That's great. Thank you, Olivia. And then Megan, and then Cynthia.
Sure. I think in addition to the educational and healthcare systems that Olivia mentioned, I mean, I do think that there's a role to sustain this work, a huge role. There has been a huge role from advocacy groups and community organizers as well as legal services providers, faith-based organizations, churches, all sorts of different social service providers. And I completely agree with Olivia in envisioning what's needed, especially for newly settling children and youth and families here. That post placement services are needed if we can imagine the system even somewhat resembling what the refugee resettlement programs look like, and even the minimal types of supports that are provided to refugees who resettle here from the federal government. I think all that at a minimum should be provided to the unaccompanied children we see resettling. In general, in the child welfare system, I would think that we should be, investing in broadband, like for everyone, in broadband services and wireless services to ensure that all low-income families and those living in rural areas have access to services. And I think the systems, like the actual states and cities and counties and localities, can deepen and better their partnerships with the community organizations doing so much of this work. And finally, having more state child welfare systems institutionalize best practices around serving Latinx families with immigration issues, such as having specialized immigration units or staff, immigration attorneys working within or contracted with child welfare systems, memorandums of understanding with foreign consulates. LA County has a great model, and here in New Mexico we have a strong model as well, and there's a few other states. So but it's definitely not the same all over the country. So
I agree with everything that's been said and all the partners. I'm going to add a few partners and strategies that haven't been mentioned, but I think have been touched upon, which is we go through COVID and just in thinking around the dynamics of the intersection of child welfare and unaccompanied minors. is philanthropy and the business community. So we really galvanized the philanthropic community to set up an independent COVID-19 fund. And a little bit like Chris, you were mentioning, is that the government then sat on weekly calls with a cohort of philanthropic leaders with monies that were pouring in from folks who really cared and wanted to contribute immediately. And those funds were used for a lot of basic needs. They were also used for rental assistance and other factors. But then they were really channeled through local community-based organizations, resettlement organizations. And it turned money around very quickly. So came in through a trusted source, went to a community-based level, and we're meeting immediate needs without this long, extensive request for a proposal process that often for new initiatives can really take quite a bit of time. So it was putting capital in the system in a very quick way, and then bringing the business community along to support different initiatives. So a lot of what we ended up doing in terms of supporting some of the homeless food distribution was actually then paying the local restaurants that would have otherwise been closed. So basically repositioning investments with businesses so that they could remain in business, but then also serve a purpose to support the work that was happening on the ground. So that was, there's an example of how you work with the business community to then serve a greater need and support, the community at the same time. I just want to echo what Megan said. I believe that broadband coverage is now considered, or that I'm excited about the conversations of viewing it as a public utility and viewing how access and technology now is a given, and it's unacceptable for kids and individuals to use smartphones as the device of learning. So I definitely think the accessibility of devices and the access to the internet. The last thing I'll say is, because you said, what can we do to make sure Latinos are at the table, impact local policy? If you're not already in it, commit yourself to public service. And, sometimes I'm the only Latina at the table, which is hard to believe that in this day and age. But I do think that doing the work and bringing your experiences to the work is really important. There's nothing more rewarding than public service. It is really painful at times, but you can't change policy if you're not at the table. So you can also find ways to volunteer, support, get engaged. It's incredibly rewarding, and surprisingly, the opportunities I've had far have exceeded my expectations. So public service is a great, steady career track for the Latino community.
That's great. Okay, so I'm going to jump right into Q&A before we get parting thoughts from each of you. And Cynthia, related to the comments you just made, we had one question. How do we attract more diverse and culturally competent staff to do this critical work? So open it up to anyone. Obviously, Cynthia, I know you just kind of referenced it.
Sure. I would just say at a personal level, I think that investing in the partnerships of those community-based organizations, some of the best city officials come from community-based organizations. And so also recruiting, both from colleges, high schools that, are predominantly attended by particular communities, particularly Latino communities, is a very smart. There are a lot of benefits that folks are unaware of. And what we've tried to do is make sure we have more faces like myself and others that are out there talking about what they've been able to accomplish in their career, and how do you make that more available to other folks, and thinking about it as a career instead of just thinking like, oh my God, I'm going to be a social worker my whole life, and that there's actually so many more opportunities. So I think it's both local, but using also the trusted community organizations to recruit from as well.
And Megan and Olivia,
Mentorship.
I'm gonna let you get in here. I just want to also add another question related to that. So feel free to answer one or the other or both.
Okay.
How can we increase trust and build better social safety nets for Latino families? What do authentic connections look like?
Well, I think
Yeah. So
oh, go ahead, Megan.
go ahead. Okay. I think what I was just going to add to is I'm in a Hispanic serving institution, and an actual majority of our students are first generation college students. English is often not their first language, and so I think what Olivia was getting at and was started to say mentorship. Part of it is creating and making sure that students have that Latinx students have all the kinds of supports and mentorship that they need to get to navigate our educational systems, to get the training and education that they need to be able to get into certain kinds of positions. As well as specific leadership training. And I know, in our social work program, for example, a large part of it is not just is teaching them not how to just it's not a just, but not how to only be a caseworker or a clinician for a family, but how to manage and how to lead programs and government programs, or even in nonprofits, things like that. And a lot of it, I think, is at the organizational and at the government level, there has to be a concerted effort, an intentional effort to purposefully hire more Latinx and Hispanic people of those different backgrounds. And so I think it's also the responsibility of our leadership in our government to make sure that that's what we're doing. Go ahead, Olivia. I won't say any more at this point.
I was just going to really focus on the mentorship part, because I think that, when we talk about authentic relationships, we bring ourselves to this work, right? So I myself came as an undocumented person as a child, and, have been able to succeed because I had someone guide me. My parents don't speak English. Spanish was my first language. And I think when the community sees people they can relate to, that's how you build the authentic relationships. We've been talking a lot about at Casey how even with therapists, need to be able to connect with the children and families if they're going to be helping a family get their children back or reunified, or so really looking like them, understanding their experience. And so when we look at the cost of college right now, especially for graduate school, it's so prohibitively expensive that, there might be, going back to Cynthia, maybe philanthropy and, who can, like business, who can get money on the street much faster than government, is really putting forth more of those opportunities, so that, and making them available to communities so that they're able to tap into the resources, because cost right now for graduate school is, really expensive. And that's where you, really need to go to in order to delve into like these other higher leadership positions. So mentoring, I think, is key.
I just want to add again, just because I think it was important that Megan said the will of government and the will of leaders in government to invest in initiatives that support. So, for example, we established a scholarship in our community college to pay for college for those who can afford, and it's irregardless of your status. And so that was a very specific commitment the mayor made to take out of, the general pool of money for the city, and have this scholarship fund designated exclusively to make sure that low income, particularly Latino children, but also folks who didn't have access to traditional scholarships and didn't want to have debt. So I do think that is a critically important. And then a lot of child welfare systems, I think I can credit with, and also attorneys who work in family law, is debt forgiveness is big if you go into this work. In Philadelphia, actually across the entire Commonwealth, they will cover the majority of your masters if you're in child welfare. You have to give time back to the system, but it's pretty awesome because we also it's again, how do you work with your own workforce, and how do you expand the diversity of that workforce? Is we allow the time, the student time, the internship time to be associated with your work time. So you're getting paid and you're getting your master's degree, and you're not having to try to kill yourself to do both. So that has actually been an incredibly successful program in the Commonwealth, and for Philadelphia, it's been we have an incredibly diverse social work team, and I think it's a product of some of those early investments.
Great. So I'm going to ask two questions just because I'm going to try to get to as many of the questions as possible. So feel free to just jump in on either or both. One question is, reforms in child welfare have sometimes been reactive and happen after tragedies. What are some examples of proactive, effective child welfare strategies? And then a broader question, how do we address the immigration backlog? What are new policies that can streamline the process?
Well, I would just go to Casey has this vision of 21st century child welfare, where it's really a public health approach to child welfare. We're not intervening once the children or families are already in the child welfare, but how do we do things, prevention services? And part of that is building community, right? And we've been talking about system navigators, promotoras, really knowing, having families know where to go to get orientation and assistance and direction for whatever problems they start encountering in life. And so Casey has really invested in the 21st century model here in LA, in a rural part of Los Angeles that not a lot of people know about, which is Antelope Valley. So, it's really, I think, moving that intervention from, when you're in the system to early on providing families what they need. And it would be much more cost effective than what we're doing now. So I think there's a big movement in trying to support those policies, like with Family First as well, another federal legislation that really is looking at prevention. So that's one area that I think.
Any other comments, questions? Cynthia?
I know we're running shorter on time, but I was just going to highlight that I have to highlight that there's been more unfortunate development of bad policy as a reaction to a tragedy versus a reflection of maybe what's not already working. So what often happens is there's additional policy that gets layered on versus, revisiting. Is there actually something we have to take off the table that would give a worker or a family more time to address? So there's actually a safety culture, which Casey has also been involved in, around the aviation use. So when an accident happens in the aviation industry, it's a very different response and reaction. And so I think that there's actually been elements that we've been taking to, really focus on the front end, which is who's the children that are coming to our attention, and only children who are really experiencing abuse and neglect to the point in which their safety is compromised, and that we can't overextend ourselves. So I think that there is this transition to believing kids need to be home in their families, and I think that's been a huge shift. It takes a lot of courage to be willing to screen out cases that are really more general neglect issues based on poverty than a safety issue. And that's that's a hard rub because it gets more philosophical and subjective than something as concrete as a physical abuse, which is very clear. And so I think that there's movement to making sure that we're more engaged in those physical and sexual abuse cases and looking at prevention and intervention on the general protective side.
All right, great. Well, thank you so much for answering all those great questions. The last question I'll ask as you share your concluding thoughts. It would be great if each of you could share, one thing that you would want our audience to take away from this panel as well as any final thoughts based on the conversation. Olivia, would you like to start?
Sure, I've been thinking about this, and I think reiterating the resilience and the hope that the unaccompanied children are bringing to this country. If we really maximize what they're able to, the skills and the work ethic that they're coming with, and provide the right supports, I think they could be such a great asset to this country. Might be in the positions that we're in right now one day. So I would, advocate for post-placement services for this community.
Megan?
I think I would like to just reiterate that we don't want to forget or diminish the relationship between child welfare system involvement, again, in poverty, as Cynthia was just talking about, and that poverty really needs to be addressed in all sorts of policy initiatives in order to prevent entry into the child welfare system. And I want to recognize that there is still, and there has been lots of evidence of bias and discrimination in reporting and in decision making within child welfare systems. And so that we know that once kids enter into the child welfare system, entering into foster care is further traumatizing to children. It's not better than them staying at home, even if there has been evidence of abuse or neglect. So I envision, a new system or a public health system having much larger investments in keeping children at home at whatever cost, with whatever supports they need to stay safe in their homes, and completely getting rid of the current system we have that puts children into facilities and even non-family homes. And so I would just like for that to kind of be the vision we are aspiring to.
Great. Cynthia?
Just quick, that they're children, that we're kids. It was a long time ago that we were little kids, and I think we lose focus that these are young people who often cannot defend themselves in the world like we can as adults, and that as adults we often get in the way of treating children like children, and we have a responsibility to remember that they are kids. They're the future of our society, and that we need to put them in this respect and integrity.
Okay, that is wonderful. Really appreciate all of those insights. And I will just say that, what an incredible conversation. You may have seen me jotting down some notes of everything that I learned from all three of you. Just such a robust conversation, talking about everything from innovation during the pandemic to immigration reform, the diversity of a coalition that needs to tackle this, everyone from faith-based to healthcare to lawyers, the role of local governments, and obviously the value of these welcoming communities that we're seeing in Philadelphia or in LA, but also the role that the state and federal governments can play, philanthropy, business, but really appreciate those final comments in terms of at the heart of this work, right? What we are grounded in is the fact that they are children. So I just want to say thank you to our great panelists for this thoughtful discussion. So grateful for sharing not just your professional expertise, but even the personal connections that you all have to this issue. And then to our audience for the engagement, the interest, the great questions that you allowed me to ask. We have a full slate of sessions scheduled for today, including our closing plenary and the CHCI Alumni Association Leadership Awards. So we invite you to please keep tweeting with your hashtag CHCIHHM21, and please join us for the virtual 44th Annual Awards Gala celebration later this evening from 6:30 to 8 p.m. Eastern Standard Time. Once you register for the conference, you will also be registered for the gala. So nothing more to do than just log right back in. Thank you again for your attendance, and enjoy the rest of your conference and the rest of the day. Appreciate you having this conversation with us.